Have you ever wondered what's actually in the pills you take every day? Most of us trust that the medications prescribed by our doctors are safe, but what if some of these commonly used drugs could be harming our brains? Research is increasingly linking certain widely used medications to a higher risk of dementia. This isn't just speculation. There's a growing body of evidence connecting these drugs to cognitive decline. We're not talking about obscure medications. These are drugs that millions of people use daily for conditions like allergies, depression, and heartburn. The idea that everyday medications might contribute to dementia is unsettling and challenges our assumption that approved drugs are always safe. However, the human body is complex, and even beneficial medicines can have unintended effects, especially with long-term use. In this video, we're exploring an intriguing topic: common medications that could potentially lead to serious dementia. Are these daily drugs truly a risk, or is it just a myth? What does the science say? Over 50 million people worldwide have dementia, with more than 60% of them living in low and middle-income countries. Each year, nearly 10 million new cases are diagnosed. Dementia can result from various diseases and brain injuries, with Alzheimer's being the leading cause, responsible for 60–70% of cases. It affects multiple aspects of life, including thinking, memory, and mood, making daily activities more challenging. Additionally, certain medications can increase the risk of developing dementia. Based on current research, there are 5 types of medications that seem to pose the biggest risk. Let's explore what they are. The use of antidepressant medication has been suggested to contribute to dementia pathology through adverse anticholinergic and vascular effects, potentially accelerating cognitive decline and increasing the risk of dementia. Older adults may be particularly susceptible to these adverse effects due to age-related changes in pharmacokinetics and pharmacodynamics, such as reduced acetylcholine-mediated transmission in the brain and increased blood-brain barrier permeability. Approximately 10% of the population in high-income countries uses antidepressants, with usage becoming more common as people age. This percentage has more than doubled in recent decades. Despite the frequent prescription of antidepressants, their long-term effects are still uncertain, as clinical trials often focus on short-term follow-up, which limits the investigation of chronic use and long-term adverse outcomes. Long-term observational data are needed to better understand these effects, but current cohort studies have produced mixed results. Antiparkinsonism anticholinergics are commonly used to treat Parkinson's disease, particularly for managing tremor. However, there are growing concerns about a potential link between anticholinergics and an increased risk of dementia. According to the National Health Insurance Research Database of Taiwan, the study included 30,740 patients newly diagnosed with Parkinson's disease, who were matched based on propensity scores. Patients who received anti-Parkinson drugs within the first year of their disease diagnosis were categorized into 2 groups based on exposure duration: 6 months or more and less than 6 months. Conditional Cox proportional hazards regression was used to evaluate the risk of developing dementia. Patients exposed to anti-Parkinson drugs for 6 months or more had a significantly higher risk of dementia. Subgroup analyses revealed that this increased risk was further amplified by conventional dementia risk factors such as age, hypertension, diabetes, and hyperlipidemia. Longer exposure to anti-Parkinson drugs was associated with an increased risk of dementia in patients with early-stage Parkinson's disease, likely due to the class effect of anticholinergics. While anti-Parkinson drugs are effective for managing Parkinson's disease symptoms, their prescription should be approached with caution. A large study conducted in the UK and published in the BMJ has suggested that antipsychotic drugs may pose greater risks for serious health conditions than previously thought. These drugs are often prescribed to manage severe dementia symptoms such as agitation, hallucinations, and delusions. Despite known risks, their use has increased during the COVID-19 pandemic. The research, conducted by the universities of Manchester, Nottingham, Edinburgh, and Dundee, analyzed health records of over 150,000 people in England over the age of 50 with a dementia diagnosis. Prof. Darren Ashcroft, the study's senior author from the University of Manchester, noted that the rise in prescriptions of antipsychotics to people with dementia, despite existing safety warnings, underscores the need for careful evaluation of potential benefits versus risks and regular review of treatment plans. The new study found that over a 10-year period, people with dementia who were newly prescribed antipsychotic drugs had a higher likelihood of experiencing stroke, blood clots, heart attack, heart failure, fractures, pneumonia, and kidney injury compared to those who were not prescribed these drugs. Despite these risks, managing severe dementia symptoms remains a challenge, and antipsychotics can be crucial for certain cases. With nearly 1 million people affected by dementia in the UK, there is a pressing need for continued research and development in this area. The use of bladder antimuscarinics is widespread among the elderly, but recent population-based studies have raised concerns about an increased risk of dementia with prolonged use of these drugs. These studies have included patients using sulfonacin, a bladder antimuscarinic introduced in 2005, which was developed to be more selective for M3 receptors and potentially safer than older antimuscarinics like oxybutynin, particularly in terms of cognitive effects. Bladder antimuscarinics have varying pharmacological properties, including differences in their ability to cross the blood-brain barrier, receptor selectivity, and brain efflux mechanisms, which can affect their central nervous system impact. Given the current evidence, it is prudent to avoid prolonged use of sulfonacin in elderly patients until more definitive long-term studies establish its safety. A recent study from the University of Eastern Finland and the German Center for Neurodegenerative Diseases has found an association between the use of anti-epileptic drugs and an increased risk of Alzheimer's disease and dementia. Continuous use of anti-epileptic drugs for more than a year was linked to a 15% increased risk of Alzheimer's disease in the Finnish dataset and a 30% increased risk of dementia in the German dataset. Some anti-epileptic drugs are known to impair cognitive function, which encompasses various aspects of information processing. The researchers discovered that the risk of dementia was particularly associated with anti-epileptic drugs that impair cognitive function. Specifically, these drugs were associated with a 60% increased risk of dementia. Senior researcher Heidi Taipale from the University of Eastern Finland emphasized the need for more research into the long-term cognitive effects of these drugs, especially in older individuals. Beyond epilepsy, anti-epileptic drugs are also used to treat neuropathic pain, bipolar disorder, and generalized anxiety disorder. This study is the largest of its kind to date and is the first to examine the relationship between regularity of use, dose, and the risk of dementia, comparing anti-epileptic drugs with and without cognitive impairing effects. The findings were published in the Journal of the American Geriatric Society. Before we wrap up, here's a quick piece of advice. Always stay informed about the medications you're taking. Understanding their potential side effects, including any links to serious conditions like dementia, is crucial for maintaining your health. If you found this video valuable, please give it a thumbs up and hit that subscribe button to stay updated on more important health topics. Your support helps us continue bringing you insightful content. Until next time, take care.